I'm speaking today, I've got multiple hats on. Not only am I a volunteer with this organization, so I know its entire history. I was one of the founding board members. But I'm also a person who's battled MS and won some of the battles. Still have more to fight. I've battled it for 40 years, at least. I mean, let's face it, we're probably born with this, you know, it just takes 19 years to come off, right? And so what I can tell you is that this is my journey, but it could be any one of yours. It could be your journey. And so what I'm doing today is I'm telling you a lot of things that will illustrate my path through the past, well, from birth to now. I'm 59. But it also will show you a person who's trying different things, trying to find some answers. And I will be honest with you in graphic detail about what's working and what's not. And I hope that you can take from that how you can adapt it to your own personal journey. And I look forward to knowing more of you as the day goes on and hearing more of your stories. So this is my story. And I'm going to focus today on the bladder, because that was my first symptom. Just move the mouse out of the way. So this is me. I was probably about 2 years old. I still remember that red velvet dress. And I had a great childhood. I was a happy child. I was a healthy child. And so I don't want you to look at what I described to you today and say, what a sick person. I actually am going to describe a lot of the things that went wrong through my life, health-wise. But I was a healthy person. I was a energetic, happy child, fourth child in the family, so I was the baby. I was just this ball of joy that was passed from knee to knee. So for the first 10 years, I had tonsillitis every year. I lived in British Columbia. I had 3 siblings, older siblings. They all had their tonsils pulled. When I got to be 3 years old and my parents said, well, she's 3, she's getting tonsillitis every year, maybe you need to pull her tonsils, British Columbia said, we don't do that anymore. We wait until the child is 10 to see whether they grow out of it, because a lot of kids grow out of them. Why pull tonsils if you don't have to? So I continued to get tonsillitis every year. What does tonsillitis mean? Antibiotics. And I got mononucleosis at the age of 10. That's my first round of mononucleosis at the age of 10. It was only about a week long. It was not a big hit, but nevertheless, antibiotics. And I used to get tonsillitis at least once a year, by the way. For the next decade, the tonsillitis continued, but what happened is instead of pulling my tonsils at the age of 10, my family moved me to England 1 month after I turned 10. My mother took me to the doctor and said, well, she's 10, you're going to pull her tonsils now, right? They said, no, in England we don't pull tonsils at the age of 10, we pull them only up to the age of 5. So I missed out. So I continued to get tonsillitis. And now these are approximations. Somewhere along that pathway, strep throat took over. And I stopped getting tonsillitis and I started getting strep. Again, got that Q-tip that goes down your throat, and I did those swabs. And you'll see that I've estimated that that continued through my adult life. I'm an educator. I teach at first high school. I was a high school teacher, then universities. And I'd lose my voice, strep, every year. Almost every year, I'm sure of it. Along that time, I started to get teeth blow up. And I'm really sorry that David Williams, oh, he's here. Hello, David. I'm glad that he's here because I'm going to be showing a really scary picture of my teeth in a few slides. Every few years, a tooth would blow up. I would get a toothache, I'd be at the dentist, sometimes they would pull it, sometimes they'd just jack me up with antibiotics, send me on my merry way, and a few years later that same tooth would blow up and they'd finally pull it. And sometimes give me antibiotics just because. Again, I had mono. Now you notice the stripe is a bit longer. I came home from playing field hockey, and I was the captain of every sports team. I was the top academic student in my school, so I was a very happy, successful student. However, came home from playing field hockey one day, had a bit of a cough, scratchy throat, and a fever, That was the first week in November. I did not attend school again until the 1st of June. I had mononucleosis, I got bacterial pneumonia, viral pneumonia. I was on antibiotics for that whole stretch. We were in England. We moved from England the 1st of April. Moved back to Canada. And my bed was the last thing they moved from our house when the taxi cabs came to pick us up to the airport. And they put the seats down on the airport, they buckled me in, I had to sleep all the way home. And I did not get out of bed until the 3rd week of May. So I was basically bedbound with mononucleosis for a protracted period as a 14-year-old, 13, 14. Along that decade, towards the end of that decade, the urinary tract infections started. I often say the bladder was my first MS symptom. It basically wouldn't go. Those of you that go, oh, you know, I can't keep it in, that's not me. I had a tank, and I'm an educator. I loved having a tank that never had to go because guess what? I could go once in the morning, teach all day, and then go once on my way home. You know, I was good to go the whole day. And so I got UTIs, a lot of them. And you'll see that story here in a moment. My first neurologist backdated my MS to when my bladder really showed signs of shutting down at age 19. So that was an unofficial MS diagnosis. I never saw a neurologist back then. Even though I was clumsy, I tripped a lot, nobody ever thought that I had MS. I've been called a classic case, by the way, of relapsing remitting multiple sclerosis. All right, so the strep throat continued, like I said, mixed in with laryngitis, which you don't take antibiotics for, but they sometimes give you antibiotics anyway. And the UTIs. Probably 2 to 3 a year at that point, but that's a whole decade, so I'm sure you can do the math. Also in that time, I had 2 cesarean sections, 2 beautiful, big babies. I mention them not because they put you on antibiotics, but every time they go near me with a catheter, I would get a raging bladder infection. I'd be on antibiotics, even though I'd just given birth. And a urologist was not diagnosed with MS, decided to do 2 surgeries on my bladder to try to fix it. It didn't work. He described it as putting a hockey stick up your bladder and trying to stretch it to make it void more easily. Didn't work, but he tried it twice. All right, the next decade. Strep throat, I put it every 2nd year because I think it was tapering off. I wasn't an educator in the classroom anymore, but I distinctly remember being tested for strep throat when I was doing my PhD, which is in the next decade. So I know I was still dealing with it well into my 40s. The UTIs picked up speed, probably getting 5 to 10 a year at that point. My official MS diagnosis in 91. Again, another tooth blew up in that decade. And I was diagnosed with severe anemia, and trying to get rid of that became quite a challenge. It was related to hormones, just absolutely heavy blood loss every month, and my diet just couldn't keep up. And if you know anything about iron in the body, iron is necessary to fight infection. If you don't have iron, you're not going to fight an infection, so it kind of compounded the UTI problem, the fact that I had severe anemia. The advice to me was to eat a handful of raisins every day to deal with my severe anemia. Okay, so the next decade. On we go, strep throat about every 2nd year. UTIs picking up speed. They're now probably 10 or more a year. Anemia is getting severe. I went to the doctor, I distinctly remember it. It was in 2006, the year after I started my PhD, and at SFU, and I said, I feel terrible. I must be coming down with a bladder infection. Could you test me for strep throat? My throat is on fire. So she swabbed me. Of course, I had a bladder infection. But she said, anemia is your #1 health problem. And she said, "You're so low in iron, I am amazed you function." And I said, "Well, I'm getting your PhD." She said, "I don't know how you get out of bed in the morning." She said, "Your iron stores are dangerously low." That was 2006. She gave me the Health Canada approved sheet. These are foods you eat to bolster your iron. So I started eating pumpkin seeds and clams, which clams are actually a really good source of iron. So I started eating more iron-rich foods, but it didn't help because those women in the audience know you lose a lot of iron every month. And that problem in me, as I approached menopause, was getting worse and worse and worse. The iron loss was, you just could not keep up with it through diet. The red star is when that came to a head. I was in my doctor. He was testing me frequently now for iron loss, and he was getting worried. And he actually, at one point, prescribed me 900 milligrams of a, and I'm sorry, Bill, you probably know the name of the drug I was probably given. It was a ferritin or ferrous sulfate.
Yeah, ferrous sulfate.
It wouldn't be a sulfate because I'm allergic to sulfa, so.
No, ferrous gluconate.
Yeah, it would have been something like that. It was a little green pill that I took 3 times a day. And so I started to take these iron pills on the Monday. And on Thursday, he said, "I think you better go get your blood tested again." So I went and got my blood tested again. And Monday morning, he phoned us. I think Landon, it was about 6 in the morning, and he said, "Can Landon take you directly to the hospital?" My iron stores had bottomed out. And so for those of you, Canada healthcare system, imagine this. Landon drives me to the hospital. It's about a 35-minute drive. We arrive at the hospital. I had a manual wheelchair. He gets the manual wheelchair out. He's putting me in the wheelchair. A man walks out of the hospital, like commissioner, like Danny here at the front, and says, "Are you Sandra Birrell?" We're hundreds of feet from the door of the hospital. And I said, "Yes." And he said, "Your doctor phoned, come with me." It was the start of the swine flu epidemic. And of course, I had no iron stores. And I had multiple sclerosis. Those are the 2 risk factors for death from swine flu. So they took me to a back entrance to the general hospital into a secure, clean room to be treated so that I never came in contact with anybody else in the hospital because it was too dangerous for me to be in the waiting room. And so what they ended up doing is they ended up doing a D&C to shock the uterus and to stop the bleeding, stop the blood loss, and they inserted a IUD that had hormones in it to try to jolt me out of bleeding so heavily. And they decided not to do a blood transfusion because they said, because I'd been taking these iron supplements for about a week, I had a whole bunch of reticulocytes in my blood work, and they said, "You're going to be fine once the blood bleeding stops." But that was pretty major. I was hospitalized for that, and they snuck me out of the hospital to get me home. And then 2 days later, guess what? I had no iron yet, so I had this raging infection from the operation. And they snuck me into the hospital again, and the doctor said, "You can't be here." I remember him saying to me, "Every minute you are in this building, you are at risk." He said, he gave me a pill. I have no idea what it was except it was an antibiotic. He said, "Take this, it will kill everything in you." He said, "We don't have any ability to figure out what went wrong, like where you have the infection, but we know you have a post-op infection." He said, "Take this," and then he gave me 2 prescriptions for more antibiotics. One went for 10 days, one went for 3 days, and sent me on my merry way. Along that time, I was also on the one and only intervention I tried on the pharmaceutical side for my MS, which was Rebif. I did 8.5 years of that. I think it's important to mention that the Rebif, which is a disease-modifying, immune-modifying drug, did not affect my immunity. Like, I was getting bladder infections before I got Rebif, and I got bladder infections after I was on Rebif. I got bladder infections after I went off Rebif. So, although you can point a finger and say, well, I didn't have a functioning immune system because it was being modulated by a drug, that obviously wasn't the case, because I was on this trajectory long before I started on a disease-modifying drug. I don't think it did me any favors, but who knows? Jury's out on that one. So that's up to my 50s. At this point, I now have evidence that starts in 2010. Starting in 2010, I logged in and registered with the BC system that allows us to see our own blood work results, our own lab results. So I don't have data for the first 8 months of the year, but I had many, many UTIs. Let me just say that I had so many UTIs that orange dot along the top line there is a positive urinalysis result showing I have a bladder infection. And at that point, my neurologist put me on daily antibiotics to try to stop me getting bladder infections. She said, Sandra, you've had so many prescriptions of antibiotics, you get so many infections, let's try a daily dose. You'll see that I got treated for CCSVI. In July that year, I was on antibiotics while I was being treated. I remember taking antibiotics. I have one person to thank in the audience, many times actually, Dr. Bill Code, who I met later that year, asked me to consider going gluten-free, which I did in October, November 2010. The asterisk there is, I was gluten-free like probably many of you have tried to be gluten-free. You're gluten-free, but if somebody gives you French fries that are fried in oil that also had fish batter, you still eat them. I was gluten-free in that you go to the cosmetic counter and you buy lipstick and you put it on. You don't know that all lipstick has gluten in it, unless you deliberately buy gluten-free lipstick, which I'll tell you is very hard to find. So the asterisk means I was gluten-free, but okay, I'm a sushi lover. Did you know that spider crab rolls have gluten in them? I had no idea. You go out and you get a spider crab roll. They actually deep fry the spider crab in a batter before they put it in the sushi. It's probably why it's so delicious. So those are the things. I was gluten-free with an asterisk because I wasn't as diligent about checking the source that I could have been. I stopped Rebif because I knew my angioplasty was scheduled and I did not want anything interfering with that. I diagnosed myself as having triggered into secondary progressive. I was no longer getting relapses as we knew them in the past 20, 30 years, so I took myself off Rebif. All right, the next year. The top line shows you positive lab results for urinary tract infections. These are the positive results as recorded by the BC laboratory system. I would, many times, just go to a doctor's office and they do a smear on a microscope slide and say there's white blood cells in your urine, we're giving you an antibiotic. Landon and I travel a lot. I've gone to doctors all over the place, other provinces, Europe, where they say, you've got a UTI, here's antibiotics. So each of those orange dot represents antibiotics that I was prescribed by, as a result of a BC lab result, but it's underrepresented. It's underrepresenting the true number of UTIs I had. The next line down shows you that at one point in that year, I actually had a clear urinalysis. I had a habit of, encouragement from my doctor, of not only doing a lab test to confirm the diagnosis, but a lab test to make sure it's clear, which is why a lot of those rounds of antibiotics are back-to-back, because I would go, be put on antibiotics, go get a test 10 days after you finish, and it still shows a UTI. 2011 was also the year that my doctor decided to send me to a urologist to try to figure this problem out. I was on antibiotics when I went in to see him. I was 5 days into a prescription. He did a cystoscopy, I think, where they do an internal scan of the bladder. He showed it to me on the TV screen, and he said, Sandra, he said, the inside of your bladder wall looks like a pimply teenager's face. He said, I can't tell you're on antibiotics at all. he said, you're 5 days into antibiotics, this bladder wall should be clean by now. So he prescribed me a different antibiotic. I also had my second angioplasty February 15th of that year. And I continued with my gluten-free diet. I do want to say that I tried everything. I know you women are sitting there and say, I bet you didn't try. I tried everything to cure these UTIs. I tried every cranberry compound known to mankind. First started with ocean spray, which of course is full of sugar. Realized that ocean spray cranberry cocktail is full of sugar, so we went to raw, organic, unpasteurized cranberry juice that I would put in club soda. We tried baking soda, which apparently helps some women swallow buckets of baking soda. We tried, my urologist put me on a concentrated form of cranberry, urocranose, I think it's called. I had D-mannose, which is another supplement. I've still got truckloads of it in my cupboards. We tried everything, and right down to, and I'll get very personal here, our sex life. Because you think about where are you getting these bladder infections from, and I'm thinking, well, maybe I'm getting them because I have an intimate partner. And it doesn't help your intimacy when you're terrified to make love with someone because you think, I'm going to get a bladder infection every time I do. And I can tell Landon now that it had nothing to do with the bladder infections, but at the time, in the moment when I'm getting so many, we just didn't know. And abstinence didn't cure it, I'll tell you that. They didn't stop the bladder infections. So there was nothing that we could do to stop them coming. They were on their own path. 2012, bladder infections continue. Along this time, I met Dr. David Williams, who's now stepped out. And, you know, he's a dentist. He was on our board, and I'm just chatting away with him one day, and he tells me that there's another way to do dentistry. There's a way that the dentist looks at your whole body, that you don't just look at clean those teeth and do that root canal and fill that tooth, but you actually look at holistically the whole body. I think Bill describes it in his book as a biological dentist, or biologic dentist. And that's certainly what I needed. So at David's urging, I found a dentist and did bite correction. Bite correction is where they actually build up some of your lower teeth so that all the teeth have a safe landing zone, like all your teeth land and match the ones on top. I had a very skewed face. It was, you know, a lot of you talk kind of a little crooked. If I look at pictures of myself, I actually had a imbalanced face. So bite correction also addresses an important thing, and that's swallowing. You need to swallow, and if you can't make a safe landing zone for all your upper and lower teeth to match up, you can't swallow correctly. And I was a clencher. Anybody else clench teeth in here? Yeah. I used to clench teeth probably about 7 times a day. I would do a little mini clench. Like I would just be focused on work. I'd be staring at the computer. I'd just find myself starting to clench. I'd go, oh, relax. And you just, relax. Okay, got rid of it. And sometimes you're afraid that it's gonna like keep catapulting and really lock up, and you're like, okay, now I've really got to relax. Well, David told me, if you are conscious that you're clenching during the day, can you imagine what's happening at night? So I went to my dentist. Before I did this bite correction, I went to my former dentist, and I brought her David's paper on teeth clenching, and I said, I clench my teeth, and she goes, well, yes, I know you do. You've got microfractures in all your teeth. She had never mentioned this to me, so I now have a new dentist. She was just willing to do the teeth cleaning and the whatevers and ignoring the fact that I obviously had a problem with clenching my teeth. I thought it was just me, and I did not know it was related to neurological health because nobody had ever mentioned that to me, but it is. So after bite correction, you don't clench your teeth anymore. You stop. Your jaw is relaxed. You swallow better. You know, anybody else, when you go to the dentist and they lean you back, you're, oh gosh, don't want to tip over, that you're afraid you're going to choke? Stops once you get bite correction. You can swallow. It's great. You know, I used to, you know, a hairdresser, washing your hair, I'd be like, oh, just breathe, Sandra, you can't, you know, you wax if you choke. All that stopped. Because I was working with a biological dentist, I also had my mercury fillings removed. They do it the right way. They have this great big fan in front of you that's sucking the air out. Nobody in the room is exposed to the mercury vapor. They actually don't drill the fillings because drilling the mercury filling just exposes, you know. So they actually just use like these proby things and they just rocked it gently until the thing just popped out. And David, you'll probably say I'm not describing it correctly, but that's how they got all these mercury things out of my teeth, and then I was good to go. Okay, so David's another person I have to thank. The third person, also a board member I have to thank, isn't here today, and that's Bernie Yerling. After I had done my mostly gluten-free, like I wasn't eating gluten deliberately, but I was being exposed to it through my casual approach to deep fryers and things, and lipstick and things like that. Well, my mother was ill during this period and eventually died in March 2013. And Bernie asked me how she was doing, and I described her illness. Her kidneys were failing. And she had an anti-neutrophil illness, and that was destroying her kidneys. And then I ordered my meal. We were at a restaurant, and I ordered it gluten-free. And his wife asked, Bernie's wife asked me, oh, Sandra, you eat gluten-free? And I described that, yes, it was recommended. It gets rid of the inflammatory particle gluten. And yes, I do eat gluten-free. And I said, when I get exposed to gluten, my feet swell up, and I get spots on them. And which is kind of different. It's not the stomach ache, it's feet swelling. And I noticed Bernie, he's a scientist, and he keeps this little pad in his chest pocket. He whipped it out like this, and he wrote something down, and he puts it back in his pocket. He emailed me at 6 in the morning and said he'd been up through the night studying my mother's kidney illness and my gluten reaction. And he said, Sandra, your response to gluten is an anti-neutrophil response. He said, never eat gluten again. He said, I think your mother may be dying of a lifelong, undiagnosed gluten allergy. And so I stopped. At that point, every supplement, everything, if it's not marked gluten-free, it doesn't go in my mouth. Okay, watch what happens. Things are starting to thin out a little bit. Starting with 100% gluten-free, and you can second guess what was the trigger that started to thin these UTIs out, but I actually had fewer UTIs in 2013 than I did in 2012. And I want to counter that by saying that was probably the most stressful period of my life. This is when I was writing my dissertation. The first 3 months is when my mother died, and I was primary caregiver for her through her death. And then the latter part of the year is when I said, okay, now that my mom's gone and I've got my head back, I've got to finish my dissertation. So I put my head down and I worked 22 hours, I sleep 3, work 7, sleep 8, work 22. I mean, I had no schedule at all for months at a time while I finished that dissertation, and the UTIs were thinning out. I had another tooth blow up in the middle of that dissertation run, which is typical. I also put NUCA therapy in there for any of you that may have tried that type of chiropractic. I was also doing physiotherapy and strength training and a whole bunch of other things. So I was trying a lot of stuff, but I wanted to highlight the fact that I also tried NUCA. And of course, I continued to be 100% gluten-free. All right. That's me at graduation. 2014, only 3 positive UTI results, only 3 prescriptions of antibiotics. Again, writing my dissertation, defended my dissertation, did my oral exam on April 1st. I don't know why that date is always cropping up in my life. April 1st. At Bill's urging, I also went to an all-organic diet. Except when you're in a restaurant, you know, you've got to lighten up a little bit when you're in a restaurant. But at home, where I can control it, we eat organic food. And Bill also involved me in a nutrition study in MS, where he told me that they found exceedingly high values of oxalates in my blood, or urine, I guess. And so he told me that spinach and rhubarb are particularly high. So I used to eat buckets of spinach because why? I was anemic. So I stopped eating spinach, and I just switched to other forms of vegetables. He also told me I was allergic to lettuce, coffee, beef, which I wasn't eating meat at the time. I was eating vegetarian and seafood only at that point. So it told me some foods to avoid, which I think is also really pivotal. You'll notice on the bottom, I stopped going 100% gluten-free and I started on the Walls diet. The Walls diet is 100% gluten-free. It's also dairy-free, grain-free, sugar-free. And we had Terry Walls as our speaker the following year, but what we did is we actually went and listened to her speak on September 14th that year, and Landon and I decided to make our household compliant with her diet. And I don't want to make it sound like you just give up a lot of stuff, because you add a lot of stuff in. You add in the most delicious salads you ever had in your life, plus you add in things like seaweed, you know. I know that doesn't sound tasty, but it is not, and it's a lifestyle. It's not only the food that you eat, but it's the meditation that you do, and your commitment to exercise, your commitment to your mind, body, and soul. And so, you know, the Walls diet is just one of many approaches out there for health. And I just picked that one. It spoke to me because Terry Walls also had a mitochondrial problem. You've probably seen her TED Talk, Minding My Mitochondria. Bill had told me as a result of that study, he and Dr. Bill Shaw had done on MS patients, that my mitochondria were deficient. So I thought, gee, if Terry's were deficient, mine are deficient, maybe her diet will help me. So I started her diet in September 14th that year. I was good for about 3 weeks rather, and then I spent the next 2.5 months on the couch. I was exhausted. I'm a pretty high functioning person. I'm not used to being in bed. I don't nap. And I couldn't get off the couch. My arms were like lead. In fact, phoning Landon, I would put my cell phone on the couch, end of the couch, and I would put the cell phone there because I couldn't hold my hand up to phone people. I was exhausted, and in her book, she describes you might go through 7 to 10 days of feeling a die-off reaction go through you because you've got things that yeast in your body to die off, perhaps. I was actually wiped until January 5th, 2015. All right, David, this is my mouth. This is a jaw infection. I know it looks scary, I'm sorry. This is a 3D picture of my teeth. And David, I wondered, you can see the jawbone being eroded there, right? I went into my biological dentist for a routine checkup, and he said, we haven't done x-rays in a while, Sandra. So they did x-rays, and they said, we can see something at the tip of this tooth. Let's x-ray again a bit higher. They x-rayed again a bit higher. And then they said, we need to see a 3-dimensional x-ray. So David, can you quickly say what that is that's in my jaw?
3D x-rays have taken over for endodontists and that because they show things that the old x-rays completely miss, and this is a great example of that. And the opening in the bone that you can see there around those root tips, I've seen those in some severe cases of jaw clenching, and they tested. So what a dentist would do is, when you see those on any X-ray and then confirm it with a 3D X-ray, you do have to be thorough and check them for vitality, which is, they call it an ice test, where you just take dry ice and put it on a cotton pellet and touch the other teeth and find out what the standard response is, right? Well, that, you know, and the ice test makes the tooth feel sensitivity, but as soon as the temperature goes away, the pain goes away, or the twinge goes away. And so if you did vitality tests on those two teeth, I had seen teeth that would have looked like that it was on a 2D X-ray, but on the 3D X-ray, that tested vital. So it's not always the tooth is dead and abscessing, which is the standard. That's the way dentists think. Oh, those teeth are dead and they need root canals. It isn't always that way. And when I talk, you'll understand where I'm coming from as far as the forces that are exerted on those teeth. And that, you know, I wasn't there, so I mean,
Yeah.
but what you're seeing is probably the body trying to wall off an infection caused by the death of the nerves of those teeth. That's the standard answer, right? And so I mean that it's pretty obvious, and those are quite severe. Notice how the tip of the root is right in the center of that oval over each tooth. That's pretty indicative that it's an endodontic problem. But anyways, that's what I see. Yeah, scary.
Well, it scared Landon and I when we saw this picture of my teeth, and we said, what do we do about this? You know, I've got an infection in my jaw and I had no symptoms. Okay, I'll back that up a little bit. I had a little tiny symptom that David had warned me about. Every 3 or 4 months, I'd get a little tiny, you know, my tongue would feel something up in my gum, and I'd play with it and it would pop. That was a sign of the infection. And that was the only symptom I had. There was no pain. It was this anaerobic, the way I understand it, bacteria that likes to eat bone, eating my jaw. So I go to a biological dentist. He doesn't use antibiotics. Recommended hyperbaric. So that's me in the tank, and that's our dog, Bungie. And so I started doing hyperbaric therapy. So you'll notice, this 2015, now I bumped up to a low oxalate diet across the board, not just spinach. Wall's diet now through and through. The spirochete infection is what was in my jaw. That was diagnosed in early April. And then Landon and I, we did it together. We did 29 hyperbaric treatments in a row over 60 days. And then you'll see that sporadically again throughout. That one positive urinalysis on the middle of September there, I did not go on antibiotics. I got the lab result, and my body fought it like a trooper, and I was over it before I would have been able to get to the drugstore to get antibiotics. So I was so proud of my body for fighting it off. 2016, the low oxalate diet continues. Wall's diet continues. I continue to do intermittent hyperbarics. I also, because of all the antibiotic damage, Terry Walls had recommended I do microbiota transplants. So Bill, Landon, and I all went to the UK, and we got 10 days of transplants. And the line extends through the rest of the year because they send you home with samples that you can insert up your bum yourself to continue the therapy at home. I also had a pretty bad fall at the beginning of September, and as a result of that and the pain that ensued, I took Bill up on something that he told me about, and I started near-infrared light therapy, which is a type of light therapy that deals with oxidative stress in the body, but also is really good at reducing inflammation. 2017, not a hint of a UTI. Now I'm just into management. You can see that everything's bright colors. I didn't do that deliberately, but it does look more cheerful. Not only do I continue with all the other therapies, I add pillow oxygen, which is we buy one of these oxygen concentrators, and we sleep with a little tube of oxygen coming into our bedroom near our pillow. And so we have more oxygen in every breath that we take than is in this room right now. And I also do something called exercise with oxygen therapy. And so I actually wear a mask when I'm exercising and I'm breathing pure oxygen. But you'll notice at the end of last year, I had a pretty bad concussion. December 12th, did a backflip off the scooter, down 11-inch step, and cut my head open. And so for the last year, I've been dealing with the symptoms of a concussion on top of MS, which is probably starting to thin out, but every so often I still get a hint of an issue there. So in 2018, I'm sorry the stripes go all the way to the end, we're not quite at the end of the year yet, but you'll see that I did more hyperbaric, some in longer stints to deal with the concussion, and I also continue with the near-infrared and the pillow oxygen. So I'm pretty much in a stable place with my health right now. No, I'm not jumping up and walking or biking 20 miles a day like Terry Walls can do, but I think I'm an honest story of what can happen with better diet and how I truly believe that a wheelchair is nothing. Like when people say, oh, I don't want to get MS, I'm terrified of being in a wheelchair. Driving a scooter is the least of my problems. The bladder infections would have killed me. And I was quickly on that path to get a bladder infection that would have killed me, because we've all lost people. So the big picture, if you want to sum it all up and squeeze it together, this is what happened. And you can sort of see the concurrent strategies I was using, and you can look at the dotted line at the top to show how the bladder infections started to taper off as I went from mostly gluten-free in the blue to 100% gluten-free in the purple to the Walls diet in the olive green there. And the bite correction, the mercury filling, the 2 CSVI treatments, and the NUCA treatments. Those are everything sort of summed up, and you can see how I've thinned it out. I really, really encourage you, if you are dealing with bladder infections, if you're on that roller coaster, I don't know how they get better other than what I did. And I didn't set out to cure my bladder infections. I thought I was helping my MS with the diet changes, but I ended up curing my bladder infections, which I'll take it because that was a severe health problem for me. So this is me today. We have a BC grow up in the corner there. No, not that kind. We grow a lot of organic veggies, and so that's me starting seedlings in our window in the early spring. We have a greenhouse and a garden. We don't use any chemicals. We try to farm it as organically as we can, and when we can't grow all our own vegetables, we buy from organic producers. We're fortunate to live in a place that has lots of producers, Bill being one of them. There's me doing exercise with oxygen on my bicycle. I also do muscular stimulation, electronic stimulation, to help rehabilitate muscles. So that's a hamstring placement there to help my hamstrings. And I also have a Bowflex, and I work out every single day. And so it's vital to keep active. If you're sitting on a scooter or a wheelchair or just not moving around too much, it is important and possible to still exercise every single day. And the last is my Headspace continuous streak, 286 days of meditation on Headspace app. Yay. So Headspace is an app. That Calm is another one for meditation, and every day. And if you'd have asked me a year ago, would you or 10 years ago, would you start meditating every day, I would have said you're nuts. But no, do it every day. This is another aspect of my life that you might find interesting. The fecal microbiota transplants I had, I documented in a blog that my early trials with it. If you're curious about a patient's perspective on getting these transplants and what it means, I do have some science in there as well. That's the link to my personal blog about it. And it's pretty graphic, but I try to keep it funny as well. Because I think we should laugh about these things. I didn't talk to my doctors about my problems I was having with constipation and irritable bowel until it was too late. And I think we need to be more open about it and challenge our doctors to do more, because I didn't think, even when I brought it to their attention, I didn't think they had a lot of solutions other than just the drugs. So I'll be part of the panel if you have questions, or you can hit me up at lunch if you have any questions about this. I'd love to hear some more of your stories. Thank you so much for your time today.
So questions from the audience? Anyone have any questions? Anything on my...
Yeah, one of the two.
Okay, go ahead.
I'm just wondering if you ever tried, sorry, I'm a nurse by background, I'm
Yeah.
listening to your care and treatment, and I'm having auriculations. You probably saw them on my face, but did you ever try pelvic therapy at all?
For what?
Well, there's pelvic physiotherapy that works within your pelvis and around your bladder and around your vaginal area and everything, and it helps with all of those things, like your bladder's not working and bowel function and that kind of thing. So I think it's not very well known, so I was just curious if you had ever come across it.
My pelvis has been a problem all my adult life. Even when I was still walking beautifully, my physiotherapist would do pelvic adjustments.
No, this is different, it's actually internal, and...
No, I never tried that.
Yeah, anyway, it's something to think about. I know it's now more popular worldwide, and we do have pelvic physiotherapists here in Halifax, and they've been shown to be quite useful in MS, just to re-startle or re-establish the connection with the nerves.
Yes, yes.
And I wanted to ask if you were diabetic as well.
No, Bill, my latest, what is it, A1C? A1C is 5.3, so that's good, right? That's normal. And that was just a week before I came here, so no, not. Although diabetes does run in my family. Any other questions? Yes?
Have you ever tried Cystex?
Cystex.
For cystitis of the bladder? You can buy it in the States, and any time you start with the urinary tract infection, it stops it right away.
Do you know what the component is? It may be long ago that was a different brand name, or?
You just buy it over the counter. Walmart.
Is it the one that's based on like baking soda, like it's an alkaline?
I have no idea.
I know I had one of those that I tried.
It works, you can't buy it in Canada.
Yes, there was one of those that I got when I was in Europe and the US that the pharmacist said you can't get in Canada. Didn't work for me, unfortunately. But, yeah. Yes?
Sandra, when you were describing the Wall's diet, I missed a couple things that you said there. You said it was gluten-free, grain-free?
Dairy-free.
Dairy-free.
Sugar-free.
Okay.
Those are the big ones. Things like you only eat meat that has been fed naturally, like pastured animals, no corn, no soy in their diet. Obviously you don't eat corn yourself. And wild fish. So anything that's, caught on a line caught is good. Yes?
I just wanted to echo what the other person said here. I had pelvic therapy and it was very, very beneficial. And I had a complication with a transversal sling to support bladder. Honestly, I wasn't able to walk, I wasn't able to sit down, and the pelvic therapy was, it really made a difference.
And I will look into it, so thank you, because since my CCSVI treatment, I started voiding more. Like, oh, I should mention, I've been catheterizing since 2002. You know, my bladder eventually just quit voiding on its own. But once I had the CCSVI treatment, I started voiding a little bit on my own, but I still had to catheterize because my bladder was still, you know, partly full. And my urologist was like, well, that shouldn't happen, he said to me when I told him I was voiding a little bit now on my own every time I go. But it's still nowhere near complete. And if that pelvic therapy could help me develop that connection again so that I could void more, I definitely will look into it. Thank you for that. Anyone else? Yes, Kathleen.
I wasn't aware of how often you had mono. And, you know, there's the known connection between the Epstein-Barr virus and multiple sclerosis. Do you track your EBV loads and treat them now? Or?
No, I've never gone down that path. And I actually had mono a third time I didn't put in there when I was a first-year university student. No, I haven't gone down that path. If you know about it, please let me know. Yeah. Anything else, or is it lunchtime?
I think it's lunchtime. So thanks, Sandra Birrell, for your informative and very revealing health history. That's more than most people would want to talk about, but I think there's some information in there that